Hi, Dr. Scott Freed, the doctor in the house. Here to talk to you today a little bit about semi-flexible dynamic step-down braces. Imagine, if you will, a healing device that your staff could put in a microwave and apply to the hand and wrist in under a minute. Your patient would be comforted, relieved, and smile at you. You'd be paid well for your healing services, perhaps modalities and education along with this. Your patient would thank you and be forever loyal. You might just call that a miracle. Meet the Miracle Splint Pro. Doctor in the House is honored to partner with Advanced Orthopaedics to bring doctors a line of superior medical grade products. Neither doctors nor insurers can question the clinical appropriateness or billing for these products, as these braces are designed by an orthopedic surgeon, a hand surgeon, myself, for real patients, to relieve pain, promote healing, and yet still allow for mobility. I know that the practice of medicine, as well as the business of medicine, is not easy today. Sometimes I personally struggle, feeling like an outsider, just trying to hold on to balance that desire to take care of people and have the time to deal with the financial pressures of the practice of medicine. And all of us, at every level, in every aspect, are dealing with the same thing. As an upper extremity surgeon specializing in hand surgery and surgeries like carpal tunnel, ligament injuries, tendinitis, and tennis elbow, it's always been important to me that post-surgery my patients have protection and, where appropriate, mobility, the ability to move during the healing process. It also became apparent to me that many patients can heal without surgery. After 30-some years in practice, I've seen many patients who shouldn't have had surgery and many patients who benefited, but I've also seen a lot who can actually heal without an operation, if given the proper protection for their injuries or conditions, and especially through the use of orthotic braces. That's why applying a standard cock-up wrist brace with its rigid immobilization in exactly the wrong position is wrong for healing. It's absolutely the wrong choice. Patients with carpal tunnel, nerve damage, tendinitis don't require rigid immobilization, and especially not in that cocked up back position, putting more pressure here, putting more pressure on the wrist and forearm. The literature says it's wrong. We surgeons, therapists, and even the orthotists know it's wrong. But these studies and scholarly articles have been mostly ignored. Not only doesn't it work, but it creates stiffness, increased pressure in the carpal tunnel, and it doesn't allow the structures to slide or move through the tissues the way they normally should. I'd just like to take a moment and kind of share with you what it's like to be inside the human body, what we see as surgeons and what I look at, and the reason I think that it's important to have braces that are dynamic, that move, that actually protect structures and what we're dealing with. And I use ultrasound a lot in my practice, and I don't know how many of you are familiar with ultrasound. I know we have a baby on board with us here, so you're certainly familiar with the ultrasound and baby ultrasound. And that ultrasound is the same we use to look at ligaments, tendons, muscle, and nerves in the hand, wrist, and forearm. And the dynamic ultrasound allows me to have a patient move their wrist, hand, see how the tendons work, and evaluate the actual pathologies.
So I'd like to share with you just a couple ultrasound images to kind of orient here. Basically, this is an ultrasound of the carpal tunnel, and the image on the left here that I'm circling is the longitudinal view, the long view of the median nerve going through here into the hand. And right here, this dark tube-like structure with the white around it is the median nerve. The palm is up here. The wrist, the bones of the wrist, you can see some bone back here. And these are your flexor tendons, the cables that move the fingers. And you notice it's streaking black and white in there. That is a little inflammation or tendinitis in there. In a cross section, if I cut off my wrist and looked end on, this is a cross section view over here. And we see these tendons right in this area. And then right here in the center is that median nerve, the carpal tunnel, and the ligament is here. So this whole circular area in here is the carpal tunnel. And what I want you to be aware of are two things. Number one, the white that's around the nerve, either on the long view and or the cross-cut section. And then the dark areas around these tendons, which is tendinitis, inflammation. And inflammation is the underlying pathology that we treat in most problems, whether they're ligament injuries, tendon injuries, muscle injuries, and the like. In the next view, we see what happens here when a patient moves and bends their fingers and wrist, and you see the median nerve pops back and forth when I do that. If we look at this on the long view, here's the median nerve, and we have a median nerve here that's compressed under the ligament up here, and you might notice it's narrower here, and it gets wider over here because the nerve swells, it gets compressed. So when the wrist is cocked back in a cock-up splint, we get this pressure on the nerve in here, bumps it, and causes more swelling, more pressure on that nerve. Now, when we have a patient who has a median nerve or carpal tunnel problem or tendinitis, and we see a good deal of the tendinitis here, we look what happens when we have this in static view, and then watch what happens over here when this patient brings their wrist back or makes a fist or stresses that hand and wrist. Watch what happens here as that goes. You'll see right here that nerve disappears, and then when they release it, it reappears. So wrist neutral, when the patient is wrist neutral, you can see the nerve and the tendinitis is relatively calm. But when the wrist is bent back, you see the nerve disappear and then reappears as the wrist comes to neutral. So this is what we see in the operating room. This is what the pathology is when we look at these nerves and nerve problems.
Carpal tunnel, tendinitis, inflammation at the hand, wrist. Braces may well now be the gold standard. Injection plus splinting or therapy plus splinting carries nearly the same success rate as surgery. So why not go the easy way, especially in patients who have early carpal tunnel and early tendinitis or ligament injuries? Very often we can avoid surgery. When it's necessary, it's great, but sometimes we can avoid it. So using customizable, semi-flexible, dynamic splints is very important. And that's what is key about our braces. They allow for motion, but at the same time protecting the ligaments, tendons, and nerves. By making some movement possible, they allow inflammation to calm down, but let patients live their lives and not be inhibited by the rigid and poorly positioned braces that are available on the market today. Our braces are very different. They fit differently, they look different, they are customized to the patient in only minutes, and they are designed to complement your clinical treatment program and allow your patients to heal. I've designed all of our braces with input from my therapist as we worked over the course of the past 30 years making custom splints and braces. The doctor-in-the-house wrist braces you see are the result of what we've created, which previously could only be had by a therapist or orthotist who custom molded a brace to the patient. No one else has semi-flexible, heat-moldable, and progressive step-down braces, patient-tested in severe conditions. The braces the doctor-in-the-house line have inside them multiple removable orthoplast panels, and these panels are bendable, moldable, and conform to the patient's hand, and you can add or remove as the clinical situation progresses, improves, or if patients have setbacks. The brace is designed in layers, allowing heat and massaging to occur to the tissues. As the patient moves in the protected motion of the brace, this dynamic interaction of heating and massaging allows protected daytime use and still comfort and decrease in the inflammation. The patient's able to live life, eat, cook, even play a keyboard or a musical instrument. Having raised gymnasts, I can tell you, it's even possible to do a handstand and give your arms protection. Essentially, our wrist, just like our shoulder device, which is a simple fanny pack with no neck straps, allows people to continue their daily activities while supported in a kinder and gentler way, continually bringing the patient back to wrist neutral for optimal healing. And when you apply it, the entire brace can simply be placed in a microwave oven for 30 to 60 seconds, and then you place the brace on the arm, rest it on a flat surface in neutral, and you have a customized brace. Further, for night comfort and arthritis, tendinitis patients, there's also the T-piece or the night rest, which can be inserted. As we talked about, in many cases we can avoid surgery, or if the problem's too substantial and surgery is required, this is the ultimate protection post-operatively. There's also an option of dynamic traction. If you need this post-operatively or for a partial tendon laceration, it's generally used by our hand therapists and hand surgeons for post-op patients.
So this is the brace. This is the Miracle Splint.
Thank you.
It's very easy to put on. Simple. 3 straps. And the key is, you'll notice, this one's been molded to my hand. With these braces heat mold. You stick them in a microwave for 60 seconds. You stick in the whole brace, and it molds directly to the hand and wrist. Note that it's fairly rigid, fairly solid. I have all the orthoplast pieces in this brace currently. The brace allows me to flex and extend. It allows me to move my fingers well, which any standard brace should, but it's very different than the cock-ups, which would have me sitting back up like this in a rigid position, and I can't move the arm well. If you have a problem like tennis elbow, you're fighting against the brace, whereas here it gives you a little movement. The same for carpal tunnel or tendinitis or inflammation at the hand and wrist. Ligament injuries at the wrist, the same thing. These braces allow for multiple options with respect to that. Now, the thing about the braces that we developed, and again, this brace is based on the brace we created in our therapy unit. My therapist and myself went through multiple designs of these braces, and one of the key components and the major factors that make these braces different is that inside the brace is a orthoplastic piece. It's a piece of orthoplast. In fact, there's 3 in this brace. There's the one at the wrist, and then there are 2 more here in the forearm. and I won't take them all out, but basically these come in and out. So according to how rigid you want to immobilize someone or how flexible you want that brace to be. Often for carpal tunnel, tendinitis, low-level ligament injuries, I'll pull this long one out here. I'll pull out B and even C and take them out because the patients don't need that rigid immobilization. So you can take that out. You take out C as well. And just close the flap up and keep in the initial piece. So basically that would stay here. So basically here you have now a much more flexible, comfortable brace, but still giving good support. Now we have easier motion and patients can live their lives. They can type at a keyboard. They can grab things. They can go to the gym. You can do a lot in this brace. You cannot do in a cock-up wrist brace, which is banging here and rubbing on the wrist and keeping it rigid. I've raised 2 gymnasts, and we've raised 2 gymnasts. My wife did all the work, but basically 2 gymnasts, you can do handstands in this brace and comfortably. So yeah, they are very comfortable, very easy to use. And again, the nice thing about them is, and the wonderful, wonderful feeling you have, and when you take a brace like this, you stick it in the microwave for 45 seconds, then you put it on the patient, have them sit their hand on a table for 60 seconds. It molds, literally molds custom to their hand and wrist. That's important because when you have a brace that is custom molded, it's an entirely different ballgame. And people look at you and they say, that feels good. And it does feel good. And I've worn it myself. And I'll tell you, if you're hurting, you know, it takes the pressure off. And if you have a problem like tennis elbow, ligament injuries at the wrist and hand, what a difference in living life where you're not having pain. And for the most part, it enhances other treatments, therapy, ultrasound, stim, dynamic therapy, activator guns, overall nerve sliding, stress, massage treatments. They, along with the brace, calm down that inflammation, that tendinitis, and it makes a tremendous difference in the healing. And frankly, you have happy patients. It's very simple to use. There is another piece to the brace, and we call it the T piece because it looks like a T, and I'm very creative. But it's actually a night resting piece for the fingers. Now, that can slide into the pouch, or some patients just will slide it in this way, and you slide it in, and it supports the fingers. So basically, if you have a patient with arthritis, tendinitis, trigger finger, anything on those lines, that again can be molded to the patient, but they sit in this patient brace and they can sit at night when they're sleeping. It's much more comfortable. And in fact, the literature also shows that with carpal tunnel, it further enhances the ability of the brace to actually heal the patient and avoid surgical intervention. So the statistics are there. It's a nice additional piece. It's easy. It's very comforting for patients. And again, it's not too rigid. They have a little bit of motion here. I like it a lot. Hey, my patients with trigger finger, people come in, they say, oh, I have trigger finger. I'm going to need to have surgery and release it. Not necessarily so. Trigger finger, this brace and injection often will take care of it. Therapy along with it will take care of it. And yeah, some patients are going to need surgery, but post-operatively, ligaments have to heal, soft tissues have to heal. Healing post-operatively for ligament, scar tissue, perineural scar around the nerves to calm down takes between 6 months and 2 years to fully mature. So the first 4 to 6 weeks post-operatively, calm it down, allow it to heal in a gentler way, put the patient in a splint, put them in the brace. And again, they can still move. They have it this way, that way, or any way they want it. We also have the dynamic traction portion to the brace. This is usually used by the therapists and docs post-op surgery. A dynamic traction is used, and I'm not going to go through all the details of it, but the dynamic traction sits in the brace here, and then the fingers come in here and these finger slings. This can be cut, molded, bent according to the patient need, but the dynamic traction allows the patient to actually begin therapy and healing of a tendon injury in this manner. And it's rubber band traction up here. And according to which fingers are involved, if it's all the fingers, you can put all the fingers in. And if not, you can just put whichever. This Velcros on according to the patient need and the spot, but basically passive extension and active flexion. For the most part, you're not going to be using it for the standard run-of-the-mill injuries, but it is available for this. And I use it sometimes if I have a patient who's got really, really bad tendinitis and things on those lines to help calm that down, extensor tendinitis or flexor tendinitis. But the dynamic traction portion is a piece of this as well. There is also the dynamic hinge. The brace can be made very rigid. It can be made very rigid as well. And this dynamic hinge is a locking hinge. It has a Allen wrench someplace around here with it, where you can actually adjust that and crank this down, and you can set any degree of motion you want. So if you have a patient with a fracture, healing post-fracture, and you want gentle motion or protected motion, you can basically then set the hinge. The hinge adds very easily into the brace. It just slides right in here in the side pouch. It says on the fine print very easily, but basically you slide it in here and it just comes right on there, and you have now a hinged brace. And again, that hinge can be set for more rigid immobilization. Frankly, I find with all three orthoplast pieces in, if we mold the patient in the right position, we don't need it. To be honest, the brace is so simple to use. I generally use it out of the box. You know, I will heat mold it, put it in the microwave. I will modify the amount of stress and rigidity I want with the orthoplast pieces. The pieces can be cut down. Again, they can be molded. The brace can be customized. And I think that that's something I really want to emphasize here in this discussion. Patients, when they are healing, need to be set the right way. We treating physicians, we docs, we therapists, fitters, people who take braces and place them on patients, create an entirely different world. This is the clinical medicine world of healing. So when we can take a brace, we can customize it to that patient. It becomes a different method of healing, but it also becomes a different method of bracing, because a standard off-the-shelf brace is great. But when you let patients on their own try to put things on, it's amazing to me what they come in with. Braces on upside down, backwards. I mean, we have our shoulder device as well, where basically we have no neck strap support from below. I find that it's a fanny pack, but people still have to understand how to put it on. Same thing with the wrist brace. I've had family members, and when we tested these braces out initially, put them on upside down. I mean, and they're educated people. I mean, these are not, so customizing braces and custom bracing and braces put on by professionals are really the future. And there is a lot to be said for that, not just for the fact that it's not going to be questioned ever. If you put a brace on a patient, you modify it and customize it, it's golden, because it's been professionally applied, it's been modified, it meets the code, and there's no question about it in any way. And down the line, more and more braces are going to be required as requiring fitting and adjustment for that reason. That's the reason we have a full therapy unit in my office for customized bracing. But with these braces, with the Miracle Splint, I get patients from all across the country write to me, call me, and say, can you help me? Where can I get a brace like you talk about in your books? Well, you can't, but now you can, because we created it. And this was based on those custom braces we make in the therapy unit. So the Miracle Splint Pro that we've developed for advanced orthopedics is made to complement the extraordinary brace line that Advanced has. The thing about the Miracle Splint is it fits the code, fits the diagnosis, and most importantly,